Hello, everyone, and welcome to Safegeriatrics. Today, I want to talk about medication administration route. What I mean is any medication you take, be it IV, oral, IM, sublingual, that's the one you put under your tongue, and subcutaneous, they have different they have their speed, metabolism, effectiveness, and toxicity. So with this content, I'm just going to tell you what goes on when you take any type of medication. Before I continue, if you're taking any medicine to take care of a symptom, like you have a fever, you have a headache, and you decide to take oral medicine to take care of that symptom, the max you can take it is 24 hours. If you take any medicine for fever or for headache and it doesn't resolve within 24 hours, you need to see a doctor so you don't continue taking that medication, and also for them to find out what is going on and then give you proper treatment. You can take medication for various reasons, either to manage a disease, treat it, or relieve you of that disease. Sometimes medications are taken as hormone therapy, like insulin. Insulin is produced by the pancreas. If the if the pancreas is not producing enough insulin, you need extra insulin to be able to manage your blood sugar. Someone who has hypothyroidism, who doesn't have enough thyroid hormones, can take medication just to boost it and then be at the normal level. Why it's important to know the kind of medicine you're taking and the effect it has in your body is, as people get older, the organs in the body doesn't react the same way to medicine as they would. So that is why it's important to know any medicine you take, how is it going to affect my body, and what can I do so I don't end up in a toxic situation while I'm trying to bring my body back to where it's supposed to be. So the first route of medication that I'm going to talk about is intravenous. Intravenous medication, once it goes into the body, it doesn't come out. That is why it is very important to give the right dose. Know what the person you're giving the injection is allergic to and what can affect them. I usually tell the people around me, unless you are in an emergency situation where the healthcare workers have to, based on their judgment, give you treatment. Every other thing that goes into your body, you have the right to know. You have the right to know what injection they want to give you. What does it do? What is the name? And so if you're reacting or if you fall sick and you go to the hospital again, you know what you're allergic to and what you are not able to take. Because with intravenous injections, it's going straight to the bloodstream. So you are absorbing 100%. So it's very important that you know what is going in. And it has the highest risk of toxicity. That is your body reacting in a way that is not supposed to if you give the wrong dose. Another one is IM, intramuscular injections. It takes about 10 to 30 minutes before it starts to absorb. It's injected into the muscle, so it takes a little time for it to begin to absorb in the body. Subcutaneous is given in the fat tissues like insulin and some blood thinners given in the fat tissue. Another one is oral. Oral medication is the slowest because it goes through that process of digestion. Before it gets to the small intestine where it starts absorption, it's going to lose its potency. In the next chapter, I'm going to talk about oral medications that don't go through this process. They are intact until they get to the process of absorption. Another one is sublingual. Most of the medicines, most of the routes that are here, the medication starts absorption, the kidney metabolizes them. But with sublingual medicine, you put under your tongue, so it bypasses that liver absorption metabolism and then goes straight into your bloodstream. One medicine that is under this is a nitroglycerin given for people who have angina, that's heart attack. to relieve them of the pain before they get the emergency care that they need. Another route is inhalation. People who are asthmatic, your inhaler is inhalation. It goes straight to the bloodstream once you inhale. Topical medications are for local infections, like people who have acne, pimple, acne, eczema, dry skin, all of those. Those are like local infections that need topical medications. Rectal, some people when they're so sick and you put oral medication in their mouth and they're running temperature, you put oral medication in their mouth, they throw it out. Sometimes rectal is the alternative they use to medicate such people, especially children who have high fever and all of that. And then transdermal. One thing I'm going to say about transdermal patch is anywhere you're going to place it, make sure there is no hair, because the hair is going to interrupt the absorption. So make sure there is no hair and don't put it on the same site. Try to rotate the site. If you're using transdermal medicine more than one time, don't put it on the same side. If you put it on maybe on your right arm the first time, the next time just change it to the left or change it to any other part of your body, just to make sure that there are no hairs there, it's not wet, and then you don't use the same side. Because if it continues to absorb on the same side, it's going to give skin irritation. So, like I said, there are fruits, there are vegetables, there are foods that we eat that could actually affect oral medicine. So, when you're taking medication, just try to look at the list. Grapefruits, it affects some blood pressure medications, some anxiety medications. Green leafy vegetables, it has vitamin K. So, if you're taking warfarin, you shouldn't take a lot of green vegetables because it's just going to counteract the effectiveness of the medicine. If you're dairy products, high potassium, if you're taking bananas, and if you're taking ACE inhibitors like lisinopril and medications like that, don't totally avoid bananas or foods that have high potassium, but just eat them in moderation so they don't raise your potassium so high. If your potassium is so high, it's going to affect the heart. So just be aware of that. If you are taking any kind of medicine and you're taking caffeine, like I said before, hypertensive medications and medications for anxiety like diazepam, lorazepam, avoid caffeine because it's going to make the anxiety to go high, and then you're taking medication is affecting the effectiveness of that medicine. So finally, oral medication, like I said before, it loses its potency through the process of digestion. But there are some medicines, oral medications, that don't lose their potency. They are enteric coated medications. They are coated because some of them are so potent that if they mix with the stomach acid, they are going to start eating up the stomach linings. Another reason they are coated is some of them, they can be lost in the stomach through that process of digestion. And another reason they coat it is because they do not want immediate release. They want it to be delayed and then start releasing in the small intestine. So some of those medicines are aspirin, omeprazole, diclofenac, naproxen. And if you ever come across any of this medicine, don't chew it, don't crush it, don't cut it into two and maybe make it in tinier pieces so you can swallow it. And then don't dissolve it in juice or water because it's not going to do what it's supposed to do in your body. If you dissolve it in water, you have already defeated the reason why it's coated. Because if it's something that could be harmful to your stomach, if you dissolve it in water and you start drinking it, you are exposing yourself to harm. I hope this information helps. Subscribe to our channel, share with your friends, like and comment if you have any questions. Thank you and have a good day.